Welcome to Health Focus, where we focus on your health. I'm your host, Dr. Scott Anderson, and today we're focusing on HIV. You know, every year we celebrate World AIDS Day on or around December 1st. And this year I think it's an important time to visit this subject as we deal with another pandemic. And in this case, we're very fortunate to have with us a distinguished guest. Our guest is Robertson Kwasi Somuah, Masters of Public Health. He has a very significant title, Senior Health Education Specialist, Solano County Department of Health and Social Services Communicable Disease Program. And it's just such a pleasure to welcome you to the show, Mr. Somuah.
Thank you, Dr. Scott. It's a pleasure to be here.
And you know, I sometimes wonder if, while we're dealing with the COVID-19 pandemic, if we sometimes forget other really important conditions. And I think HIV/AIDS certainly comes to the fore. Now, you've been fighting this battle against infectious diseases with the county for a while, I know. Tell us a little bit about your background.
So, Dr. Scott, I grew up in a small town in West Africa called Accra, Ghana. And I moved to the United States when I was a 17-year-old. I did my undergrad in New York, upstate New York, in the State University of New York. And I worked in Vermont for a number of years in the emergency room. Then I transferred over to California to do my master's in public health in Touro University. And I've been working in communicable diseases for the past 5 years. And before that, I was working in emergency medical services for traumatic injury prevention.
Well, that's fantastic. And I must say that Solano County has been a great friend of our show. We've had guests on, including Dr. Shandi Fuller, Dr. Bella Matias, and the work you do there is really outstanding. And I guess as somebody whose background is a master's of public health, you deal with different infections, but we're focusing today on HIV/AIDS. And with respect to the whole issue of this worldwide condition, tell us a little bit about where we stand in terms of the HIV/AIDS. Do you say epidemic or pandemic when you talk about it with your colleagues?
I say epidemic.
Okay. Yeah. Tell us a little bit about where we stand, both worldwide and also just locally in terms of your efforts in Solano County.
So currently there have been a lot of efforts at the local level and at the state level and at the federal level to provide prevention services to people who are highly susceptible to get HIV. So we do a number of programs such as PrEP navigation in Solano County, which is basically, PrEP is a drug, pre-exposure prophylaxis, that when a person takes it daily, it prevents HIV from happening even if they're exposed to HIV through bodily fluids. We also have a syringe exchange program that allows people to have access to new syringes so that there isn't a transmission of hepatitis C and HIV within Solano County. We have other programs such as the Migrant Outreach Program, which is more focused in the Dixon and the Vacaville area to use more language-specific education to kind of reduce the HIV rates within our migrant populations, and a number of other preventative efforts.
So it might be worthwhile, may I call you Robertson?
Yes, please do.
It might be worthwhile, Robertson, to just review a little bit about what human immunodeficiency virus is. So, of course it's a virus, it's an RNA virus. And I think we've had it really as an active infectious threat to our health since about 1981. I remember when I was just entering medical school, research was developing to identify what the virus was. And eventually it was identified as a virus, and we came to realize that it seems to be transmitted in various ways. Maybe you could tell us a little bit about that, how it's transmitted, and how you educate the public on the virus and really how to avoid getting infected and how it's spread.
Thank you for asking that question. HIV, the human immunodeficiency virus, is a virus that is transmitted mainly through bodily fluids. The main bodily fluids that transmits HIV are blood, rectal fluids, semen, vaginal fluids, and breast milk. If somebody has HIV and these fluids I just mentioned ends up inside you, however it ends up inside you, it can expose you to HIV. However, fluids such as urine, saliva, tears, those cannot transmit HIV.
So there are populations that are at particular risk of HIV infection. Maybe you could elaborate upon that.
So one of the main populations that is significantly impacted by HIV is MSM, or men who have sex with men. Also populations of people of color all around the world have disproportionate numbers of them getting HIV.
And I guess we also would be remiss if we did not mention the risk associated with injection drug use.
Yes.
In fact, even other forms of drug use, snorting drugs and so forth. And of course, if one is traveling abroad and there's any question with respect to blood transfusion, that could put one at risk.
Yes.
I think perinatal transmission from mothers to infants also should be mentioned.
Yes, however, there's been a lot of advancement that has gone into preventing HIV from getting to the children or babies before they're born.
I'm glad you mentioned that, because I'd like to focus on the positive aspect of life for people who may be living with HIV. I know that back in the 1980s, when I became acquainted with this condition as a young doctor, it really had a fairly grim prognosis. But now, of course, we have a wide variety of medications to treat HIV. Maybe you could elaborate upon those a little bit. I'm thinking of protease inhibitors.
Yes, so basically all the medication to treat HIV are known as antiretrovirals, and protease inhibitors are one of the newer ways that have been used to treat HIV. So HIV on its own is a virus that cannot replicate itself when it gets into your body. It needs to hijack your immune system to reproduce itself. And one of the main substances it needs is protease, which your body produces in abundance. So the protease inhibitors basically prevent the virus from accessing the protease. In so doing, it prevents the virus from replicating.
So the importance of treating HIV with protease inhibitors is really more than one thing, right?
Yes.
I mean, on the one hand, the individual who's being treated can be protected from the disease advancing and causing a profound immunocompromised state. So I know historically we used to measure CD4 cells, and these are the body's immune cells that fight off infections. So if we treat with a protease inhibitor, we lower the viral load and we allow the individual to maintain a healthier immune system. But perhaps also we might discuss the fact that by treating in this manner, we're also protecting other people who may not be infected.
So protease inhibitors are able to reduce the viral load to the point whereby the virus is undetectable in a person. And when you're undetectable, you're untransmissible, meaning that you cannot transmit the virus to another person if you're getting the right treatment to the point whereby your viral load is undetectable.
So one of the things that's very important is that we overcome the stigma of HIV, which does exist, let us face it, in some situations, so that people can really get the care they need, whether it's through their private doctor or Solano County, and really try to be treated as aggressively as possible to have a healthy life living with HIV. Yes. And I know this is actually something that the public is learning something about, because it's even advertised on television, that we want people to be healthy and to have successful, happy lives, employment, and so forth, even if they're struggling with HIV. Along those lines, does the county provide any services to individuals with HIV who may also have, for example, social, economic, or family problems?
Yes, the county offers a program which is federally funded called the Ryan White Part B program. And what this does is that it takes care of all the needs of a person that they may have to be able to get to the appointment, such as transportation needs, such as their food needs. And doing that, it just basically assists our HIV positive clients to get the help that they need so that they can remain untransmissible.
So the county, in fact, offers comprehensive education and care for infectious diseases. That's your area of interest, in fact, and expertise as a master's in public health. And so someone coming to the county is not just being treated with a pill, but is really receiving education, being provided with the tools necessary to thrive and prosper and stay healthy. So that's really very important. I applaud the work you do there.
Thank you, Dr. Scott.
And I would like to, though, get into a little bit the whole issue of medication. I think pre-exposure prophylaxis is a wonderful thing, and it's certainly just an important part of our armamentarium. But I have to confess, Robertson, that I feel a little concerned because if an individual, for example, is taking pre-exposure prophylaxis, but still engaging in risky sexual behavior, that individual is still at risk for other infectious diseases. And as a physician, that's something I'm concerned about. And I know that historically we really emphasize other approaches, such as the use of a latex condom to prevent infection. I hope that pre-exposure prophylaxis remains part of a comprehensive approach that includes these other strategies. I wonder if you might speak to that.
So pre-exposure prophylaxis, or PrEP for short, is the drug that I spoke about initially, that when taken can prevent infection from HIV even if you're exposed to the virus. However, PrEP has been a treatment that has been available for a number of years, and we encourage people to take it who may be highly susceptible to get HIV. However, it's part of our overall preventative effort. It's not the only tool that we encourage our county residents to use. You have to use the PrEP with condoms because PrEP does not protect you from chlamydia, gonorrhea, syphilis, which has seen significant increases in the last few years. However, it does protect you from HIV. I think the mentality sometimes is that because HIV cannot be cured, but the others can be cured, people look at it in the sense that they can cure the others. But these other sexually transmitted infections can cause so many other medical issues if you are not aware that you have it. That's why it's important to continuously get tested if you're on PrEP to make sure that you don't have any of these other infections which might have significant impact on your health.
I agree completely, but I also feel that the education component should suggest to people that even taking PrEP is not something that's going to afford you the protection that, for example, either if an individual chooses to abstain, that individual to have, or using a latex condom. Because, for example, I follow the literature, and in recent years I've on occasion seen some literature suggesting upticks in syphilis and gonorrhea in men who have sex with men, for example. And that concerns me as a physician. So I think PrEP is important, but I think it's part of a comprehensive educational strategy. Would you not agree?
I completely agree.
And speaking of educational strategies, I noticed that the World AIDS Day and the work that's been done on that with the CDC, National Institutes of Health and so forth, is looking at a prevention strategy which has been called EHE, and I believe it involves attempting to really end HIV as an ongoing epidemic in the U.S. I wonder if you might speak to that. I have a few figures that I can share, but you're probably familiar with them. The goal is, for example, to decrease HIV rates in the U.S. by 75% by 2020 and by 90% by 2030, doing research in a number of different geographic areas in the U.S., 57 areas. And the goal is to decrease the infection rate by 2030, preventing 250,000 infections. I know that these sorts of monumental goals can only be achieved if we have a comprehensive strategy with local health authorities.
Absolutely.
So I think you're at the forefront of that battle. Would you not agree?
Yes, we are as a team.
Yes.
We are working very hard to meeting those goals. And even to look at it further, we need the input of the community. We work very closely with community-based organizations to roll out a lot of these initiatives in the community, fostering the trust and the relationships that these community-based organizations already have with the community. And so we can only achieve this goal if we work together.
So tell me a little bit about what it's like as a public health official in Solano County fighting this battle. Do you go out and actually meet with people in their places of business or homes? Do you Do you go to local places of worship? Do you go to local clinics? How do you get these messages of education out to the community? Tell us a little bit more about your day-to-day life in doing that.
Thank you for asking that, Dr. Scott. So this approach to reduce or prevent HIV within Solano County is multifaceted. We have an HIV surveillance group or program that specifically monitors sexually transmitted infections within Solano County and infections that may lead to a higher susceptibility for getting HIV. We have people who investigate those cases to make sure that people do not get HIV, or if they have STDs, we make sure they get treated. We also host a number of community events with community-based organizations. We host health fairs, and we also have our rapid testing line where people can call and request an HIV test. And because of COVID, we changed it up a little bit. We have people pick up our HIV home testing kit so that they can perform the HIV test in the comfort of their homes. And with that in mind, we also have other organizations such as Solano AIDS Coalition we work closely with to get the messaging and condoms out into the community. We also work with the local LGBTQ community organizations to work with them to have their individuals in that group access testing. So it's all close work with the community, and we achieve our goals by working closely with the community.
It's really a community-wide effort.
Yes.
And one thing I would like to ask you about is the COVID-19 pandemic.
Yes.
With respect to HIV/AIDS. You know, on the one hand, I think it's really interesting, Robertson, that you have an overlap between research and medicine between different infections. So I think as we understand hepatitis C, as we understand COVID-19, we gain a body of knowledge about how viruses are transmitted that enlightens research into other viral infections, even if they're different pathophysiologically. But my question is sort of a little bit more philosophical. Do you think the COVID-19 pandemic has led to us taking our eye off the ball in terms of the battle against HIV/AIDS, or has it enriched the process because, you know, people are so much more health conscious of preventing infections of another virus? I mean, I really don't know. What do you think? I have the feeling that HIV has been a little bit forgotten, but perhaps I'm mistaken.
So I would say that there are positives and negatives with the impact of the COVID-19 pandemic on HIV awareness and testing and basically our initiatives. So at the beginning of the pandemic for COVID, it limited the number of events we could go to in the community because we weren't social gathering. We were trying to avoid any infections of COVID-19. So that limited some of the activities that we do in the community. However, we had to go back to the drawing board and see how we can still allow people to have access to our testing for HIV. So the pandemic has also had an impact and has shed more of a brighter spotlight on HIV and other diseases because it shed a light on the people who are disproportionately impacted by some of the diseases. So, and the research also that was done for COVID-19 has helped propel an interest in doing more research in vaccines and treatment for HIV. So it has both positives and negatives.
You know, in enlarging on that, you mentioned earlier populations at risk, and you mentioned people of color. Mm-hmm. And I was thinking as you said that perhaps the real issue there is not so much the individual's race or ethnicity, but the underlying issues of socioeconomics and poverty. And for example, the homeless population. And as I drive around and see homeless populations near many of the offices I go to, I realize that you have a population that is at risk for airborne infectious diseases, but also a population that has substance use issues. I go to the Tenderloin in San Francisco, I go to West Oakland, and there's some drug use that's pretty prevalent and pretty much out there. And you know, I don't see how we can treat one specific condition without being cognizant of the total socioeconomic situation for the individuals involved. And that's not to minimize personal responsibility for behavior, but I don't see how you could be healthy living in a homeless encampment by a freeway, frankly.
Dr. Scott, you're very right. A huge focus that we've been concentrating on in public health as a whole is the social determinants of health. Understanding all the political, cultural implications that impacts disease rates, and having a deep understanding of that, and having public health individuals have that focus when they're approaching public health initiatives and challenges allows you to look at the bigger picture so that you can create programs that is cognizant of what you talked about, the social determinants of health that may increase the chances of somebody acquiring a specific disease.
I think this is getting more and more attention too. I know that you have, for example, a post-bachelor disease individual who's working with you, Sophia Cruz, who's fighting this battle with you. I had the pleasure of meeting previously, and I mentioned earlier that you have Bella Matias, you have Dr. Shandy Fuller, you have the whole team, and of course you have social workers as well.
Yes, we do.
Do you feel, as we look towards the future and as the pandemic hopefully begins to wane a little bit, do you feel optimistic about the future with respect to HIV/AIDS?
I do. I feel like the COVID-19 pandemic has brought a lot of attention to public health as a whole, and there's been more funding that has been diverted towards public health. So there's going to be more work in prevention. There's also a number of vaccines and treatments that are being developed as a result of the pandemic from last year towards HIV. So the future looks bright for treatment. And
do you feel that you have the support from the community you need at Solano County Public Health? Is there anything else that you need that you feel you're not getting?
So the support, we are always working towards getting more individuals within our community to be part of our initiatives. So we are always looking for more support, whether it's in the sense of health education or partnerships to get treatment out there, to get testing out there, to get the information out there to make sure that these numbers continue to go down.
Now, of course, we're emphasizing your work with Solano County, but you mentioned that you're from West Africa. We discussed off air that you're from Ghana.
Yes.
And I'm involved in a nonprofit called Protease Global that does some work overseas fostering education among children. And part of that is fostering health and well-being. You can't really successfully have education without health. Are you at all involved in, you mentioned you've done a little bit of consulting in Ghana for HIV. Do you feel like in other countries, particularly in Africa, that things are perhaps looking better too?
Well, you mentioned the social determinants of health.
Yes.
When you look at it in the African perspective, it's a larger discrepancy with access to social services and access to preventative treatment and all that. So the future looks bright in some places, but other places need more help.
I mean, as soon as I asked the question, I realized that in my heart of hearts, I don't feel that the future is looking too bright in sub-Saharan Africa because the pandemic has just devastated the continent. And I also feel that the reporting of disease incidents there is perhaps not what it should be. And I know that when you have rampant unemployment and problems with the pandemic that are just destroying the fabric of society, it's got to be just a horrific situation in many countries, not just in Africa, but in Latin America, which has a really high rate of COVID-19 as well. As we begin to wind down, could you perhaps, Mr. Somuah, also give us a little bit of information on how people might get more information from the county on HIV, on AIDS, and also on anything related to the celebration of World AIDS Day on December 1st, which I believe is every year the same date?
Yes.
Any sources of information available through the county?
So if you go to solanocounty.org and you just type public health, within the search column of the website, a whole slew of resources is available to you, and you can find our communicable disease program or HIV prevention program, and you have a list of resources and phone numbers that you can reach us to get testing and treatment. One of the numbers that we have on the website is 707-398-8317, which is our rapid HIV testing line that allows you to have access to our rapid home testing kit, which you can pick up from the county, and you can perform this test in the comfort of your home.
Thank you. It's just been a real pleasure to have you here on the show, and I feel we've learned a lot. Again, if you're just joining us, we've been talking to Robertson, Kwasi, Somuah, MPH, who is the Senior Health and Education Specialist at Solano County Department of Health and Social Services Communicable Disease Program. Thank you so much for joining us. We're very grateful.
It was a pleasure.
Remember, here at Health Focus, we focus on your health. I'm Dr. Scott, saying it's been really great meeting with you and talking about the ongoing efforts to deal with HIV as World AIDS Day is in our presence. And thank you so much for joining us. We wish you the best of health into 2022. Thanks again for being with us. It's just been a pleasure having you.
It's a pleasure. Thank you very much.